should be all set.
Okay. Good morning, everyone. My name is Carolyn Duraco. I'm Vice President of Programs and Education. Thank you so much for joining us today. We do want to let you know there is a chat if you have any questions, or as we go through the slides, if you have any comments or thoughts or questions during that time, we're happy to pause for a moment. I do like to always know who we have with us today. So if you'd like to just in the chat, share if you're currently caring for somebody, please feel free to put that in the chat as we go through our program today. I also, Liz, Miranda, if you want to say hello and welcome everyone today.
Sure. I thank you so much for being here and for doing this. It's an incredibly important topic, and we're thrilled to be able to have you to talk about, COVID and how to kind of get through this period of caregiving. So we can't thank you enough.
Oh, thank you so much for your interest and your care and concern. So just for the agenda for today, we will speak about COVID-19 and dementia and how it does, dementia has its own challenges. And then now we have COVID-19 that adds some other challenges. And our hope today is that you know that you're not alone. And Jennifer Labrie sent all of those who registered lots of resources. So the information that I shared with you today will be available in links on our website as well. We'll be going through some tips for caregivers. Again, tips if you're caring for somebody at home, tips if you're caring for somebody that might be in an assisted living or a long-term care facility. And then, just tips for keeping yourself healthy, which is really, again, sometimes hard. The caregivers sometimes take care of themselves a little less, and we need to make sure to keep ourselves healthy. And then again, we want to make sure you leave here today with all of the Alzheimer's Association resources.
So Carolyn, we do have two responses for you in the chat, and there is a caregiver who is caring for someone who resides at an assisted living facility, and also a nurse care manager in a medical unit for patients with Alzheimer's.
Wonderful. Thank you for sharing that. So what we know is that most likely dementia itself, having a diagnosis of a dementia, whether it be caused by Alzheimer's disease or other types of chronic diseases associated with dementia. Dementia does not increase the risk for COVID. But what we do know is that dementia-related behaviors, increased age, and other health conditions that often accompany dementia may increase risk. And so what I mean by this is, so for example, somebody with dementia may not remember to wash their hands, right? We may need to give them constant reminders. We may need to give them cueing and, actually wash our hands and have them help join us. We might need to actually wash their hands together. So again, something like that. Also, they may not be comfortable wearing a mask. They may not remember why it is important to wear a mask. It may be uncomfortable. They may be frightened by somebody who approaches them who has a mask on. Also, again, somebody with dementia may drink from someone else's glass and use someone else's utensils. Again, so some of these other dementia-related behaviors may increase risk. We also know that with any other type of, with any other illness, if somebody has another infection, we often see worsened cognitive impairment. So even if somebody had the flu, if somebody has a UTI, we often may see some sudden changes and some different behavior challenges that come because of the other disease. So we see some cognitive impairment due to other viruses or other illnesses. So it makes it a little extra challenging. So I want to make sure you have our website here. We have a whole website that's dedicated to COVID-19. And we talk about tips for dementia caregivers. Particularly, there's a whole section on caregivers at home, caregivers in assisted living, home-based services, what to think about and look for, and questions to ask. And again, we'll end the program today with staying healthy. So all of this information has been emailed to you as well, but we'll go over that as we go through the slides today. So when we're thinking about caregivers at home, again, following CDC guidelines, we want to consider some of the following things. Individuals living with dementia may need support to remember, again, all those important hygienic practices. Again, placing signs. So we often, somebody with dementia may, in the beginning of the disease, particularly written reminders, signs in front of them to wash their hands. You know, when I was thinking of this, we often would go out, not so much today, but when we go to restaurants, there's a sign for the employees to remember to wash their hands, right? This might be something we may need to do in our own homes to remind our loved one to wash their hands with soap and for 20 seconds. Again, demonstrating through your own hand washing and cueing. Sometimes just getting somebody with dementia started and start that activity for them. Again, being careful of the water temperature, right? We want to make sure that's safe for them. And if they're not able to wash their hands, the hand sanitizer, minimum 60% alcohol, can be an alternative if someone cannot get to the sink or wash their hands easily. So again, just some different tips that we often may not consider, that somebody with dementia may not think to wash their hands as frequently as we should. Something we always want to be aware of, that if there's a rapid or a sudden change in a condition, which could be confusion possibly, if that occurs, we want to contact a healthcare provider. Often somebody with dementia is often progressive, and it can be slowly progressive, especially with Alzheimer's disease. But if you notice a sudden change in behavior, often that could be a sign of an infection. So that would be definitely a call to your healthcare provider. One of the other things that you can do if you're caring for somebody at home, you can speak to your pharmacist and see if maybe your prescriptions can be put out for longer number of days. So this way you're taking less frequent trips to the pharmacy. So again, it doesn't hurt to ask the question if this is something that could be possible. Something also to think about is making alternative plans for adult day. Again, please feel free to call our helpline. There are some adult days that are closed, some are open, some have different regulations. But as you care for somebody, you know, one of the things on helpline that we found is people are at home more, right? So running out of activities and things to do. So know that you can call our helpline for ideas on that as well. And we'll talk about that later. But what are some other plans that you have? If your adult day is closed, some are opening now and then they're closing. So you want to always kind of plan ahead and have that alternative plan. Also, something that we often don't think about is if you are the primary caregiver and you become ill, you know, do you have a list of other people? And I also think today, if you have not done this, write the list of 3 or 4 other people and their phone numbers and their contact. I often think about, you know, when we had our children and someone on the call just shared that they had to have a new grandson born today, but you have a bag packed. So again, you want to think about, you may never need this, right? But to write down the list of alternative caregivers that can help you if you become ill. So these are things you might want to think about. So we think about individuals in care facilities. We want to check with the facility regarding the procedures for managing COVID-19. Again, around the state, there's lots of different changes in the state demographics, and some incidences are more so in certain parts of the state. Again, here's where you want to ensure that the facility has multiple emergency contacts. You know, write that list down of important people. Sometimes it might be a family member, it might be a neighbor or a friend, but just write down those multiple emergency contacts. Again, we're not going to visit if we're experiencing any signs or symptoms ourselves of illness. I think we're all kind of something that we've been used to by now. This has been very challenging, not being able to visit a loved one in a facility. If you are unable to visit due to illness or facility lockdown, I want you to feel empowered to speak to the facility about how to best maintain contact with the person that you're caring for. This may be through emails. It may be scheduling a specific time for a phone call. Some facilities have their iPads or they have some technology programs, but it's really important for you as the caregiver to feel somehow connected. Again, depending on who you're caring for, they may not be able to use an iPad or they may not have a phone in their room. So this is where you want to talk to the facility and say, how can I best keep in touch? Can I schedule this call at the nurse's station? It might be with the rec therapist. It might be with the social worker, but you need to feel that you're connected and you want to check in how their status is. How are they doing today? And I want you to feel empowered to do that, to make those calls, to feel how can you stay connected? This square box on the top, this gray box, it goes through several of our slides, and it's really important. There is no simple answer or way to completely eliminate risk. And I want you as caregivers to know we are all doing the very best we can, but there's risk in all of our decisions. But I think being able to ask questions and making educated decisions is going to make you feel more comfortable and more confident. So some of the questions we have gotten on Helpline, and I do have Jennifer Labrie here, so afterwards, if we have any specific questions that she has heard on Helpline. But with residential facilities, we want to think about the incidents and the considerations. So maintaining somebody in the facility, we've gotten calls, do I keep my loved one in the facility? What do I do? So again, you want to feel comfortable asking the facility about their quarantine procedures. You know, what are their policies and procedures? What is in place? What is your level of confidence that the CDC guidelines are being followed? You may want to ask that question. Share with me what you are doing following those guidelines. You can ask the question about how many people in the facility have been impacted by COVID-19. And specifically, you can ask, is this staff, is it residents, or is it a combination of both? Okay, that might be an important question for you to ask. Again, is your family member able to follow social distancing procedures with or without help? We know that people living with dementia will often wander. Again, not understanding that they should stay maybe in a certain area of the facility. So are there people to help guide them? This may be something that's helping you make a decision. Does the facility have personal protective equipment? And do they have a plan moving forward and enough of supply? Again, these are questions you can ask. Also, how many staff members are interacting with your family member on a regular basis? Okay, so it is a good dementia practice to keep the same caregiver. That it is important just in dementia care because they can see some patterns and some changes. But are people coming in and out? You know, who's assigned to your family member or loved one? That might be a question that you might want to think about asking. And is the facility adequately staffed to provide the level of care required? Okay, so again, and these are some questions to feel impact. There's no simple answer, and these decisions are really hard. But at least having some of these questions might help with some of your decision making. We have had questions on our helpline. Should I move my loved one from where they are right now? Again, we always know with dementia, change is difficult, moving is difficult. And how do you make some of those decisions? Again, no simple answer. And we cannot completely eliminate risk. But again, feeling empowered to ask some of these questions. So again, thinking about it, should you move to another facility? There's no way to know whether the new facility will remain free of COVID cases, right? We've seen that in our state alone. It has moved and the geographics have changed. You may have to ask a question, is that facility even accepting new residents? Okay, and that changes often. And again, making a call to ask that question. You can ask, have there been COVID-19 cases in the new facility? Again, and you can ask specifically, is that staff or residents? And again, those questions that we asked in the previous slide would be, again, questions you would ask if you're thinking about moving to another facility. And I'll just cover this last one and then open if there's any questions. So then there's the question of, should I move my loved one home? Again, no simple answer, and we can't not totally eliminate risks. But if you're making these decisions, what are some questions you might want to ask and to brainstorm with some others about? So one of the important questions is, what level of care does the person need on a day-to-day basis? Does this person living with dementia need help eating? Are they incontinent? Dressing, bathing? So these are all questions, we call them ADLs. What do they need for their activities of daily living? So what level of care? That might make a decision whether this person would be best at home or not. Is your family able to provide that care? So first of all, what type of care is needed and how many people do we need to implement that care? And then is your family able to provide that level of care that's needed? We want to assess that number of people. Also limiting the number of people who have contact with the person with dementia, right? So it's a hard decision because you don't want a lot of people coming into the home, right? So you want to think about that number, because the more number of people, the higher risk, but also how many people do we need to care? Some people might be a 2-person lift. Somebody might be caring for a loved one and they're, not able to physically do some of the moving or the lifting. So that's something that you want to consider. Also, does anyone in the family have COVID-19? Are they showing possible symptoms, or are they at risk? Some of the decisions we've had on our helpline about going home is who in your home is out working and coming in and out. That may be something you want to think about before making that decision. Are there individuals in the home who work outside, and will you need to hire home care workers? Again, we'll share with you our list of resources. Our main goal today is to know that you are not alone, and we have lots of resources for you to be able to help guide you with some of this decision making that you may have to make. So one of the other things before we talk about activities at home, just thinking about home care in particular, and some of the questions that you may want if you're working with home care partners. Again, so I wrote down a couple of tips. So again, we want to support the person receiving care in their home. And if you're having somebody come in from an agency, I want you to feel comfortable that the person should have a temperature check before they come into your home. This is something you want to ask. When they come in, they should be washing their hands before doing any kind of care, or just when they enter. You can ask the person, have they been exposed to anyone who was in contact with anyone with COVID? Also, talk to them about their policies and procedures in their agency, and what guidelines are they following? So these are important questions for you to ask if you're having somebody come into the home to take care of your loved one. Again, also having them wear a mask. These are some things you want to make sure happen. So I want to take a minute to see if, Jennifer, there's any questions in the chat about any of the first couple of slides about making some of these decisions, caring for somebody that might be in a facility. Any questions, Jennifer, before we move on to activities?
Nope, I don't see any questions in the chat. I did put our 24/7 helpline in there for anyone who did, feel that they needed more information or wanted to talk any of the scenarios out. So, but I don't see any questions just yet.
Okay, great. So I want to talk to you about activities at home, and we can think about this in 2 different ways. If you are a family member caring for somebody, what are some activities you can do? What we find with, we know how important socialization is, and keeping busy and keeping a schedule. And then because many of the programs are not open, the adult days are not opened. So what kind of activities can you provide? So we'll talk a little bit about that. We do also have our whole website on ALZ Care that has all of these printouts for you as well. And we did send you the link. But we want to create a simple daily plan. And I emphasize the word simple. We know somebody with dementia has difficulty multitasking, right? Also, they have difficulty initiating activity. And sometimes we may think, oh, they're just sitting on the couch, they're not doing anything. But we may need to be that person to get them up to go, to actually initiate a program or an activity for them. So initiation would be helping them initiate an activity. But we want to keep it simple and keep a simple daily plan. A schedule would be very important. On the screen here, you have even just morning, afternoon, and evening routine. Again, even just jotting down some of these things that you would just kind of keep as a schedule, a routine, is going to help you as the caregiver and also help the person with dementia. A schedule and routine is really important to help the quality of life and help them be more independent. We need to keep their skills and abilities in mind. We know that somebody with dementia, this is with Alzheimer's disease, it is progressive, right? So what somebody was able to do, they may lose their abilities, but it's really important to keep the person busy, but also have a sense of purpose, that they feel like they're still participating. So for example, if somebody, setting the table might be too many tasks for somebody with dementia, right? To say, could you set the table before dinner? Somebody with dementia may actually just look at the table and not have any idea how to begin. So we maybe break these down into smaller tasks, maybe just giving them the napkins and say, can you put the napkins out? And then you give them maybe the utensils. And so when we think about working with somebody with dementia, we need to break down our tasks one thing at a time. Again, as the caregiver, sometimes it's exhausting and it takes more time, but the person with dementia will feel engaged, more of a sense of purpose. And actually, it's an activity that you're doing together. So we want to think about some of these tasks and activities as quality times with the person. Something really important. Again, same thing with example of the kitchen table. I'd love to hear if anybody in the chat has another example of something that they've done, but might be even cooking. Someone may not be able to make a whole meal any longer, but can they mix the batter? Can they add a spice that you hand to them? Again, depending on their level and their abilities to have them be engaged. We want to focus on enjoyment. And I also think about not so much the end result, but the act of doing something together. Maybe they're not playing the card game correctly. Maybe they're not putting the bingo chips on correctly, but are they enjoying that activity? And that's really what's important, to focus on the program that you're doing together, the interaction that you have together, not so much the end result, right? So we want to focus on, are they really enjoying this? At this time, we also want to be mindful of the TV and the news and some things that might be on in the background. Again, somebody with dementia, sometimes they cannot distinguish between what's reality and what is not. And I'd like to share an example of one of my colleagues who was caring for her dad at home. And dad always ate his meal. He loved dinner especially, and he would always eat and have seconds. And for like 2 evenings, he kept pushing his plate away and he was angry. And his daughter wasn't sure. She changed the food. She wasn't sure if it was something that he didn't like. And what she realized is on the television, there was some commercials about children who were starving in other countries. And he internalized that and did not want to eat until the children have eaten. And it took her a while to figure this out. But what she was able to do is before they ate, she said, Dad, all the children have already eaten. It's our turn. And then Dad was eating again. Right. So it took her a little while to figure this out, but it was the television in the background that he was seeing, and he was upset about eating. He couldn't communicate that at first. I often share with somebody who's caring for somebody with dementia, you have to be a private detective sometimes to figure out what some of these things are. We want to think about hobbies. Think about that person, maybe what their career was. Maybe they were an accountant. Maybe they were a nurse and they want to nurture. Maybe they love doing laundry. So they were a homemaker. So you want to think about, who was this person? What do they love to do? Okay. If somebody, I have our support groups, and we have many of the families are doing puzzles together. And what they noticed, if it was too hard, the person would get frustrated. So you're also going to read their body language to see are they enjoying this? Is it something that's frustrating to them? And you may have to maybe, for example, have a puzzle that's less pieces so they can feel accomplished, or you start it for them. Sometimes with activities, you may choose the activity, but also start it for them and have them maybe add, for example, for a puzzle, add one piece at a time. So you're going to maybe help them with some of the more difficult parts of the activity to help them feel engaged and a sense of purpose. One of the other things when we think about activities at home is being prepared to be flexible. So again, if somebody used to play solitaire, loves cards, maybe they can put the cards together, all the hearts, the diamonds, and the clovers, the things together. So they're still participating and doing something with activities. It may be a different level than they used to do before. I could share an example of a gentleman in my group who, again, loved golf, and he was still physically able to golf, but keeping score was very, very hard. So rather than no longer golf, he asked his buddies, hey, can you just keep score for me? Again, so his buddy was flexible, adapted to his changes, and he still stayed engaged and social and was able to participate in that activity. And that was very helpful. When we think about activities also, sometimes asking somebody with dementia for help. I think as we all love to feel needed, but to say, can you help me with this? Sometimes that's a way to have them be engaged and feel that sense of purpose again, as I shared. When we think about the activities at home, when we think about somebody that might be coming into our home to help us, again, share with, maybe it's a home health agency, share what are the habits of a lifetime? What are the What's the schedule? What brings them comfort? What brings them joy? I often will encourage you as a family member, or encourage maybe a home health agency worker to make an activity box and to put like 5 or 6 items that would create joy for this person. It might be a photo album, little photo album, maybe a favorite CD, a favorite movie. It could be a crossword puzzle, sometime a picture book, might be a favorite snack. I made my own activity box, and I had popcorn and I had M&Ms in it. But again, this is like a go-to box that anyone who's coming into your home, maybe it's a professional, it could be a family member that's giving you a break, that they might be able to go into this activity box and be able to bring those items of comfort to the person. Okay. Knowing that somebody with dementia, 15 minutes might be all their attention span for one activity or another. Okay. So with lots of other ideas for activities, we have lists of 101 activities to do. But again, for you, but also to share these ideas with somebody else who's coming into the home. I had a resident in a facility who loved peanut butter, nutter butter cookies. And even though that seemed like a very small thing to know about her, when she became anxious or wanted to go home or didn't want to stay engaged, I would pull out the peanut butter cookies, and she would sit with me and we'd have tea. And that brought her that comfort. So again, share with anyone who's helping you those habits of a lifetime, those things that bring the person comfort, even how they like their coffee or their tea. Somebody with dementia may not be able to tell you, so be able to give them as much information as you can share. So before we move on, I'd love to hear, and you can unmute, if there's something you can share about an activity that you were able to do with your loved one at home, maybe break it down into steps, or some of you that maybe having your loved one at a facility, something that you shared with them that was very important that they're able to do now with your family member or friend that you're caring for. Any thoughts or ideas about activities that you've been able to do successfully and that you've seen that person with dementia have a sense of purpose? Anyone able to share?
Hi, Carolyn. I'm John.
Yeah. Hi, John.
How are you? I'll share a story. My dog might bark, so please forgive me if that happens. But my mom is in Ridgefield Crossings, and you've covered a lot of the things that I've been trying to do. And one thing I found that works with her recently is the little picture albums and the photo albums. Those have seemed to bring her a lot of joy. And I've been trying to think of more things, more activities to get her, involved in things she used to enjoy doing. And I've been struggling and frustrated with the fact that she doesn't seem to want to do some of those things anymore. And the thing you said a few minutes ago about just like the attention span might only be able to be 15 minutes, that really just kind of like hit me and resonated with me. And it's something, it's a takeaway I need to know and to understand as I work with her. But I'm just sharing that point. But with respect to like the things that are helpful, like I just wanted to echo your point about the picture album, because she'll go through it 2, 3, 4, 5 times over and over again. And it just seems to be a moment where she's able to really feel good about, it reminds her of a lot of the good things in her life and feel good about those things, and spend some time in this place where maybe she's not really able to get to anymore without that cue and without that prop. So that's
wonderful.
One to share. Yeah.
Yeah. Thank you so much. Great example. And pictures really are very important. One of the things, another suggestion. So I was a rec therapist at a facility many years, for 18 years. And somebody, may not remember the name of the person. So sometimes we've asked families, when you do bring in photos, to write on the back, even on a sticky note, or on the back of the photo, if it keeps the photo okay, who they are. So anyone else that's maybe sitting with mom can say, oh, this is Bobby, this is your grandson, this is your nephew. Again, if she's confused and not sure who they are. The bottom line too is if she says the wrong person, that's okay too. Right? Again, if she's calling them, we're not going to correct somebody with dementia and say, oh, no, that's not, if the person's enjoying and naming someone, that's okay. But sometimes that's been helpful to put the names, so anyone that's visiting with her can share who they are. So thank you so much for sharing that. Definitely, music has been very important, and lots of different studies, how important music, the emotion, even coloring sometimes, with like adults, like different color pencils rather than maybe using crayons. So it's more dignified. I have one of the suggestions, even now when we think about the new year coming up, all of you, don't throw out your calendars. Calendars have beautiful pictures, and usually whoever's hanging a calendar up in their home, it's maybe they love cats or they love cars or they love flowers. You can laminate those pictures and actually make a beautiful picture book. And it's adult-like, and it's something that that person enjoys, and they can just look through that picture book. And that's something that we used to use as rec therapists, and brought a lot of joy to people just looking through, and very simple. So that's something that you can even ask the facility, say, get a collection of people's calendars and use those as picture books. That was very helpful when I was working. Anyone else share an activity where maybe you had to break down tasks so the person still felt engaged?
Hi, this is Marita.
Hi, Marita.
Hi, and now I have a husband who has a TBI. 21 years ago, he was hit by a drunk driver. Part of his right lobe had been removed, so I always call him my youngest child. And now that he's almost 66, I'm seeing some starts of dementia in him, very, very mild, but also some aphasia a little bit. And one of his things is that I worked with him to get him into meditation. And he used to love to come to the hospital. And now that he can't go to the hospital, he's very lost. So he tries to meditate at home. But what I've learned with him, because he still wants a Harley, is I ignore it. I don't want to engage in it. So that way, certain things I've learned now not to engage because he gets frustrated. Mm-hmm. So he's a handful, but he's home with me. I have 2 adult children and a granddaughter he adores. But through the years, I've learned stuff. But now I'm starting to see very mild dementia and a little bit of aphasia. So I'm going to take him to the neurologist. But that also, he hates being tested because he feels when they test him, he's stupid. And I'm like, you're not stupid, but it's very frustrating for him.
Yeah. No, thank you for sharing. And Maria, just as you shared, what a wonderful job you're doing reading his body language, right? So with dementia, and even if, with aphasia, the trouble with language, we know that we communicate through body language. So as the receiver and also as the giver. So somebody with dementia absolutely can read our body language and feel emotion. So sometimes, again, we have to pay attention to, we'll talk about caregiver stress, but we have to pay attention to how is my body language being interpreted, right? If I'm anxious, if I am stressed, somebody with dementia can read that. And as well as you, Marita, reading that, talking about the Harley, that was increasing frustration, right? So again, we, so often we have that toolbox, and what works today, right, may not work tomorrow. And sometimes we feel as a caregiver, what am I doing wrong? And sometimes we need to let go and say it's the disease, and you might try it again later, and it might work. So again, reading their body language and saying, okay, you know what, I'm reading the body language. This is not working. I might try it again later. But knowing communication happens. Every behavior is a form of communication. And as caregivers, we, again, are those detectives trying to figure out what is this person with dementia trying to communicate to me. And again, it's exhausting, right? And so the next slide, I think, is really apparent here, caregiver stress. So we're going to talk a little bit about that. But thank you so much for both of you for sharing with us. Again, we think about activities, we want to think about routine and engaging and schedule, but then also that word of flexibility, and being able to go with the flow. And please know that you're doing the very best you can. It's the disease process. And you might have to put something away that worked yesterday and try it again another time. Again, we think about activities, sometimes even looking at the time of day. Somebody who sundowns, which somebody maybe get more confused in the evening. So that's when we want to have things that are calmer, maybe that music. You mentioned relaxation, even giving somebody a hand massage and putting some lotion, brushing someone's hair. These are things that can really de-stress somebody. I used to actually put some of the lotion in the microwave for a couple of seconds, and it was a little warm, and somebody with dementia would just say, and they would feel so more relaxed. So sometimes relaxation techniques for us as well, if we can do it with the person, even better, give each other hand massages, right? So let's, for a moment, again, I think we've all identified caring for somebody with dementia is physically, emotionally, financially draining. We want you to know you are not alone. We have lots of support systems, which we'll talk about in a moment. But what are some of those signs of caregiver stress? Denial, anger. Sometimes we see social withdrawal, anxiety, depression, exhaustion, sleeplessness, irritability, lack of concentration, and then sometimes, even some of our own health problems. So again, Jennifer Labrie is on, and she's going to share a couple of her thoughts on when we talk about caregiver stress as the helpline. So these are, the importance of identifying some of the caregiver stress. Jennifer, is there anything you want to speak to before I get to how do we take care of ourselves? Some of the key points on identifying caregiver stress and some of the things the association, especially on helpline, we can offer.
Mm-hmm. So absolutely. And thank you all for joining us today. And, when we're talking about all the different types of settings where, we're talking about COVID and how to connect, I think in the beginning we saw people increasing their calls to our helpline asking, should I move my loved one home and out of the facility? We also had people calling because adult day centers were closing. So, there wasn't that opportunity for a break or respite for the caregiver. Some people were hesitant now to bring in home health care from home health agencies. And some of that still exists. We see some adult day centers slowly opening with tighter restrictions. People are now having their loved one, stay in assisted livings or nursing homes where they are. Some more home health care might be starting to come in, but there's still the brunt of everything is falling on you as the caregivers, right? And on your shoulders. So when there's not that respite, there's not that break, and you're caring for this person at home, having to fill every moment with activities and supervision and ensuring safety. That's a lot. That's a lot on you as the caregiver. And when you don't have that person maybe at home to hand off a few minutes of this to, some of these signs can become apparent. The other thing is that we are a little more isolated in the time of COVID, right? So we don't do well isolated and alone. We're people who need to be together and need to socialize. So we need to find those outlets and those ways to stay connected, but still stay safe and healthy, because we need to take care of ourselves, make sure we're getting to our doctor's appointments as caregivers so that we can stay healthy. Because if we're not taking care of ourselves, we can't take care of the person that is diagnosed with dementia with us. So whether they're at home, whether in an assisted living, you're still their caregiver, you're still their care partner or best advocate. So through the Alzheimer's Association, we really encourage you, reach out to that 24/7 helpline. And I did put that in the chat. Even just to talk with someone, to know that you're not alone, that you're not isolated during this. Sometimes these virtual programs that we're offering for activities and programs while people are at home, it's great to offer them, but some people don't engage well virtually even, so just that telephone conversation on our helpline, talking about what you're experiencing, talking about the feelings that you have, and what this is doing to your routine and your health. So we want to make sure that you as the caregiver is supported, taken care of. Know that you're not alone in this. If you are experiencing any of these feelings, which I think any of us right now, being home and in the time of COVID, we could probably list off, oh yeah, I have about half of these. And it's natural to experience these feelings and have these emotions. But what we do with those feelings and emotions, is key. And we don't want to sit with that by ourselves for too long. It's natural to process and need to think things through on our own. But what's our go-to? What's our support? What's our help out there? Whether it's talk therapy with a therapist or counselor, do you see a psychiatrist? Is there an underlying depression already that requires medication and some assistance or support? Is it a call to our helpline to find out what's there for me? What should I be doing? What should be my next steps to help support me so I can best take care of my loved one? And that's in no matter what setting. People at home are feeling this, but the ability to visit is greatly changed when someone is in a community or a facility right now. So what effect is that having on you and the changes you're seeing in your loved one in those facilities? So there's a lot, no matter where your person is, whether home or in a community or facility. So, I know we'll talk about the resources, Carolyn, and especially our 24/7 helpline, but definitely know there are things out there to support you and people to have conversations with, and the helpline is a great place to start. So
Great.
does that
Thank
cover?
you.
Okay.
It's always nice to have a face behind the person who might be taking that call. So I want to thank Jennifer for helping behind the scenes. So we think about caregivers stress, again, in the beginning here, taking care of yourself, and how, again, even if you just pick one of these today to say, I don't do this, I'm going to try to do it a little more. Physical activity, again, if you can get a chance to go outside and walk, I know that's been helpful for me, being home, be able to go outside. And if not, just, chair exercises, yoga exercises. Again, staying connected, very difficult in this time, but it might be making that phone call. Some of us are zoomed out on all these calls, but maybe a phone call to a friend, staying connected that way. Asking for help. This is really important. And again, as we want to be safe, some of the, you may be able to ask somebody, can they do the shopping for you? I often, when I do this caregiver stress part, I share a program I learned a few years ago. It's called Reverse Giving List. So what I'd like you to do for homework, if you have time, to write down 3 or 4 things that you wish you had help with. Again, it might be, I need time to walk the dog because if I leave the house, I'm afraid my loved one might get out and wander. Whatever it is. Maybe you don't have time to cook in the kitchen and you want to really, a nice meal. So write down 3 or 4 things that you might wish you had time for. And then think about those people in your life that have said, let me know if I could do anything, right? I often have seen in my years with dementia care that people want to help. They're just not sure how, and they don't want to impose. So sometimes if you have that list kind of already planned, the next time someone says, can I help? You might be able to say, no, if you can cook me a meal that I could stick in the refrigerator, oh, that would be so helpful. And the person who asked would probably be so glad they actually have a specific task to do and they feel like they're really helping you with what your need is. So don't be afraid to ask for help and support. Again, in these times where you may not want to have that social interaction, you want to have social distancing and be safe, it might be that they do the shopping for you. Maybe they mow the lawn. People can still help you in a distance, dropping off food for you. Again, so think about, make a list, 3 or 4 things, and then those people who have said that in your life. And I think that might help you with some of the stress that you may be experiencing. Again, relaxation. I'm going to ask everyone now just to breathe in and to breathe out. And to breathe in and to breathe out. And it seems so very simple, but sometimes that can just help you if you're dealing with somebody 24/7 in home and you just step out of a room and you just need to breathe. Biologically, physiologically, it actually is helpful, but just sometimes taking a breath with the person with dementia, holding their hands and say, let's breathe together. Some of that can help calm some of that anxiety. So think about relaxation tips, meditation, as you shared, Marita, music, maybe taking a bubble bath. Again, it might even be that you ask someone, can you just come over and sit with mom so I can do this? So things like that. Again, we'll go through resources and our support groups in just a moment. But I want you, if there was, those of you who are on the call, if you looked at these looks like stop shine, the shapes, which one do you think you need to at least do more than the other? Is there one that you say, oh, I really are not doing that? I'd love for you to put that in the chat. Out of these areas, physical activity, staying connected, asking for help, relaxation technique, accessing resources, and attending a support group, which one do you feel like you're going to need to work on? I'm going to give you a moment just to do that.
One thing that we always talk about, Carolyn, on our Healthy Brain and Healthy Body program that we do, and we talk a lot about how when a caregiver needs to take care of themselves, it's never too late to start. Today is a new day. Start off small and build and do something you enjoy. So I just wanted to share that from our other program, because I think when you're doing something you enjoy, it's easier to keep doing that and keep connected with that in yourself as well. We do have some things in the chat. 2 people, physical activity is something that they're looking to do more of. Also, Susan said asking for help. Susan, I think that's one of the hardest things for some of us to do is ask for help. And a lot of times caregivers just need to hear permission that it's okay to ask for help during this. So Carolyn and I are giving you all permission today, definitely ask for help.
And it doesn't mean that you're not the #1 best caregiver and you know that person the best, but we need help with this. But physical activity, even if you are going out to the store, park farther away. Even that simple thing is going to give you a little more activity. So sometimes you don't have to make it like a whole different time of day. Think of things that you're doing. Can you add some more steps and just park farther? So that would help you with physical activity. So again, we talked about our helpline. Again, just know that it is available 24/7 as professionals. If some of you are professionals on the call, know that you can call us as a professional. You may be working in a hospital setting. Again, professionals can call us. People often think that helpline is only for family caregivers. Even, with effective communication strategies, helping with bathing, all these different suggestions we could send you topic sheets on. Bilingual staff, we have our service in over 200 languages. It is a live chat and also for hearing impaired. Again, all of the programs, this is a special program about talking about the COVID-19, but all of our programs, we have switched at the association to everything virtual right now. We have programs just understanding the 10 warning signs. You maybe sometimes with caregiver stress, you start to think, I think I have dementia because I'm so stressed. We have programs about 10 warning signs. Understanding Alzheimer's and dementia. I often hear many times family members will get a diagnosis for their loved one, but no education. They don't know what the disease is, what will happen next, what are the stages. So we have programs on understanding Alzheimer's and dementia. Dementia conversations, about driving, about visits to the doctor. One of my favorite, and I think is the most popular program, is effective communication strategies. How can I effectively communicate? Again, looking at somebody face to face so that they're reading my body language, using cueing, again, breaking down tasks, but also verbally breaking down our sentence structure. All of these are different ways to help communication strategies. Legal and financial planning. We usually have an elder lawyer who joins us. And then the other popular one is understanding and responding to dementia-related behaviors. We changed the name of that, and I think this is really important because it's asking us as caregivers to try to understand the behavior, because every behavior is a form of communication. What is this person trying to communicate? It's a need, and they're trying to communicate it to me the best that they can. So how am I going to understand it? But then how should I best respond to this behavior? So again, even just that title reflects the training where we as the person without a disease are going to have to understand and respond to this behavior. So lots of different trainings. Again, sometimes, there's a beautiful thing now that we are using all of our virtual technology. I had a program where I had a daughter from California and a mom from Ridgefield together in the same group, where we're able to do that now virtually. So again, all of our programs are online and those are free. And they have videos where they have people sharing as caregivers their experiences, people living with the disease sharing their experiences. I do want to make sure you know that we have programs for people living with the disease, people in the early stage who are aware they have dementia and they want to talk to others and they want to have coping strategies amongst themselves and a support system. So we have programs for people and programs called Live Well. How do I live well with this disease? Again, we know this disease can last from 2 to 20 years, the average about 8. But how do I learn to live well with this disease that I have? Again, our community resource finder. Again, if you want to look up any of the programs, you can go to our programs and services. If you need a list of home care, there's a list of home care agencies, community services, assisted living, skilled nursing, and lists of geriatric psychologists and neurologists so that we can help you. If you have any trouble, of course, I always say the helpline can help us navigate those programs and those lists. This is something, again, it's called Als Connected. I'm not sure if you were aware of this program, but it's a free online community for anyone affected with Alzheimer's. It could be a caregiver, but it's kind of like a chat room where you can chat an idea or a thought. It is monitored, and then people can respond to you. Again, another way to feel connected and not alone. It could be where you're saying, I have my mom in a facility and it's really frustrating not being able to see her. How are you coping? And it may be somebody that can, talk back and forth. So it's a wonderful community of family members and friends of individuals who have lost someone with dementia. So it's kind of like a message board. And this is another program that we have. I want to make sure you knew about. It's called Als Navigator. And you kind of fill in like a profile, and it gives you an action step and a personalized action plan. So for example, someone may put in about somebody might be having trouble, maybe they're wandering and they're still driving and things like this. So it may direct you to some of our driving programs and how to have that conversation. It might personalize an action plan for our medical alert safe return program, where someone can wear a bracelet that has a 1-800 number that if they do wander, we know 6 out of 10 people with dementia will wander. And especially as the weather is getting colder, it's something we want to think about. But all of those programs we do have available. And sometimes that action plan, it might include some of those programs. So I'm going to open up for questions now or comments. Anyone in the chat have a question, Jen, that we can answer?
No, but we did have some more responses for caregivers and taking care of themselves. And I agree with you, John. Physical activity is one of the things I think all of us are having a tough time with. It's that motivation, right? And it is. I mean, we're all feeling a little bit different. It's harder to get motivated and get moving, especially on these foggy, cloudy days. I don't know how it is where you are, but definitely. And I think we need to find like those little steps, like Carolyn was saying, park a little farther, or if you walk for 10 minutes, make it 15. Start small and start with something little that's attainable and build on that. Marita also shared both of her children also help with their father, and they also let her know of any changes that they see, as well, and help with that. So I was putting the resources that you were referring to into the chat, because I know when I'm on webinars like this, I can't write fast enough. So I have been putting the resources in the chat for anyone who had missed them.
Yeah. Does anybody have any questions? Again, it could be related to some of the slides or any dementia related questions, Alzheimer's disease related questions. Any questions that you want to ask?
I have a suggestion.
Sure.
For the person who has the husband with aphasia, would it be a good idea to make cards with words that are common to his speech and have the cards around so we can look through it and pick the word that he is not able to get? Maybe make him feel better. Have a card.
Yeah. Thank you for sharing that. And they're sometimes working with a speech therapist, they do have picture boards. So someone can point to a picture. Again, some people might be able to still write, but also using pictures to point to, especially essential needs. I'm hungry, thirsty, need to use the bathroom, happy, sad, and things like that. Thank you for sharing that, Marie.
I think back to John's point too, when he was visiting, and there's, it's hard to kind of know what to do to connect. Everything's different for everyone, and it's really tuning into that personal connection and what grabs that person, whether it's music or family pictures and things like that. But I have had a couple of conversations very similar with families, and the attention span of the person in the community or the facility is very different right now. So the changes that we see, even though we have window visits or virtual visits, it's not the same as it was before 6 months or so ago. So, the attention span may be a little bit different. I had a family call, and they were at a table 6 feet away and finally got to visit with their mom. And about 7 minutes into the visit, mom said, "Okay, bye," and just got up and walked away, where before she would never want them to leave and wanted to stay and had a hard time separating. And there's just differences now a little bit. Maybe our loved ones have changed a little bit during the time that we've had this separation. So it's really just going by, their timing and what their need is. And if they're done, after 7 minutes, we need to focus on that quality 7 minutes that we had, and that their attention span is done after a certain amount of time at this point. But just to let you know, I've been hearing that a few times on our helpline.
Great. Any other questions or thoughts or takeaways, something that you might have taken away that you're going to bring back
One of the things I know that's really important, and this is going through my husband's TBI, is that when I was going through both my parents' dementia and I became their power of attorney, I became my husband's power of attorney, so that when I go to the doctor's offices, they can talk to me, because I noticed that if your name is not on anything, they don't care. They want to talk to him, and he will tell them a whole different story. So it's very important.
Yes, thank you so much. Very important. We talk about that when we have our, we also have series, early, middle, and late series of education programs, but really important to have that power of attorney, have those forms filled out at the doctor, and to go with somebody with dementia to their appointment, right? Especially early on, some people want to go by themselves possibly, but again, short-term memory with Alzheimer's disease, especially short-term memory is affected first, and they may not remember that conversation. So really important. And then also with the doctor visits, write down those questions on a piece of paper and bring that paper with you. And I have done this recently with, I had to take my daughter to the doctor, and I said, hold on a minute, let me just look at my list. And I actually took it out and I said, just let me wait for a moment, because so many times we walk out, we had all these other questions. And also sometimes being able to ask the question in front of the doctor could be hard. So again, sometimes the doctors say you can email about conditions, you could have a phone call prior to the appointment, so that you can communicate the need and what you're seeing. Again, sudden changes in condition. Again, somebody, they may have increased confusion. Again, talk to the doctor, tell them what's going on. Maybe there could be the telehealth, so you're taking less trips to the ER or to the hospital. But noting down some of those changes. Again, somebody with dementia may not say, I'm achy, I have a fever. And could they be contagious? And that, you may be seeing it in some behavior changes rather than lethargy or something else that you may not recognize. So again, any of those changes in condition, call to the doctor and write down questions and see how best. Again, we talked about how best to communicate in a facility, but also with your doctor. Can you email or talk to them prior to an appointment so that you can share some of the things that you're seeing. Any of those changes would be really important. Okay, I think we're just about at the hour. I hope that all of you, know that you're not alone, know that there's resources. Again, we are here through this journey with you, whatever stage you are at. So know that I'm happy to help you. I always say that may not have the cure right now through a medication, but there's absolutely things that we can do to better the quality of life for ourselves as the caregiver and for the person living with dementia. So there are absolutely things that we can do to make a difference. Thank you for all that you do, and know that you're doing the very best that you can. There's going to be risks, but asking questions, feeling empowered to ask those questions, and knowing every day may be different, but you're doing the very best that you can each and every day. And thank you so much for caring like you do.
Thank you. Appreciate it.